Hello, my name is Eva. I will be performing the assessment of ears, eyes, nose, throat, and respiratory and cardiac on this patient here. What is your name, please?
Sophia Roman,
What is your date of birth?
10/30/1996,
What is today's date?
February 13th, 2023.
What are you here for?
To help you.
So she is learning times 4. She is wearing proper attire. She is wearing this so she can help us with assessment. Her posture is good, so we can move on with our assessment. I will wash my hands. I just have washed my hands. I'm about to put my gloves on. And we're going to start with the head and face. So I'm inspecting the head and face, and everything is symmetrical from what I see. Color is even. I'm going to start with the scalp. I'm checking through. I see no lesions, no sparsity in the hair. Okay, I'm going to the back. I'm checking each area, and I don't see anything. Okay. Sophia, of course, you're allowing me to give you this assessment, right?
Yes.
Okay. So now I'm going to palpate your scalp. Okay. I don't feel any indentations. I don't feel any lesions. There's no drainage coming out from anywhere. So everything's symmetrical. So you are good to go. So from this point on, we're going to check for face sensation. Do you feel this?
Yes. 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 Yes.
Okay, thank you. So the next thing I'm going to do is check her TMJ. So I'm going to go in the back here. If you can open your mouth for me. Okay, close. Do you feel any clicking?
No.
Okay. Any pain?
No.
Okay. Okay, next. So now we're going to start with the eyes. We're going to start with the visual acuity test. If you can read this line right here. Oh, wait. Sorry. So cup your eye first. Now we're going to continue. If you can read this line right here.
LTFPH.
Okay. Change your eyes. Do it again.
LTFPH.
Okay, I'm confirming that what she said was both correct on both times. She has 20/20 vision. And the next thing we're going to do is we're going to check for peripheral. What we did was central vision test. Now we're going to do peripheral vision test. So if you can cup one side again, I'm going to cup the other, and tell me what numbers you see with my fingers.
1, 1, 1, 2.
Let's change sides.
1, 1, 2, 1.
Okay, very good. So the next thing we're going to do is the corneal light reflex. I'm going to take my pen light. I'm going to shine on her eyes, and I'm looking for the light to be equal on both areas, on both sides of her eyes. So everything is equal on both sides. And so now we're going to continue with the next test, which is the Hirschberg test. So if you can follow my finger, I'm going to bring it closer to you. Okay, I'm looking for symmetry. Sorry, I have to bring it back. I'm looking for symmetry of both eyes, and I'm looking for no nystagmus. The next thing we're going to do is the extraocular movements. So what we're going to do is you're going to follow my finger again, and I'm assessing for equal sides and symmetrical. Okay. So the next thing we're going to do is a corneal reflex. I'm going to take this here, cotton, And I'm going to place on the edge of her eye, looking for a reflex. Do it again. Okay. In the meantime, I'm looking. There's no sparsity in her eyebrows. Lashes are even. I'm going forward and I'm checking her sclera and checking her conjunctiva, nice and pink and moist. Her lacrimal duct, opening her eye a little bit. Okay. No erythema, no foreign objects. Look up, look down. Look down for me. Okay. And it's the same thing on both sides. So now I'm looking for the corneal reflex test, which we just did. The pupillary reaction test is just look straight. Okay. And the other side. Okay. So when I shine light to one eye, the other eye also constricts, and it's the same thing bilaterally. And the next thing I'm going to do is to check with the ophthalmoscope. I'm looking for the retina, the optic nerve, and vessels. So I'm going to need to remove my eyeglass. Okay. Everything, there's a sharp, it's a sharp shape around. I don't see any issues. Everything is clear, and I don't see like extra redness or extra vessels or anything. And I also saw the reflex light. So now we're going to move on to the ears. I'm going to first inspect the tragus and palpate at the same time. The pinna, the meatus inside. Please turn for me so I can check the tragus, the pinna, the meatus inside. Okay. I'm going to look behind the ears. Behind the ears. All right. Now I'm going to inspect inside the ears. I'm pulling the pinna outwards. And everything is nice, pearly gray. I don't see any foreign objects, any drainage. Going to the other side. Same thing, a little bit of earwax, but everything is, the membrane is pearly gray. I don't see anything out of the ordinary, no foreign object, no lesion, no drainage. So the next thing we're going to do is the whisper test. I'm going to go behind her. And I'm going to say a word and you tell me what you hear.
Cat.
I'm going to go to the other side.
Dog.
Okay. Now I'm going to do something that's called a Renee test. And you're going to tell me if you can feel and then hear.
Okay.
So. Can you hear?
Just stopped.
Still here?
Yep.
Okay. Other side. Can you hear?
Just stopped. I can still hear it.
Okay, very good. So now we go. So your air conduction is more than the bone conduction, which is normal. So now we're going to continue with the Weber test. So you're going to tell me if you're going to hear bilaterally on both sides of your ears at the same time.
Yes. I can hear it on both sides.
Okay. What about now?
It just stopped.
Okay. So Then, okay, next is going to be the inspection of the nose. I'm going to check for sinuses. This is your frontal sinuses. Any pain?
No.
Any pain?
No.
No. I'm going to check for transluminescence. Other side. So I can see underneath. Okay, other side. Okay. I'm going to palpate your bridge. Palpate. I'm going to, I want you to close one side.
Okay.
Breathe. Close the other side. Breathe. Okay. You're going to close one side again. What do you smell?
Chocolate.
Good job. Close the other side.
Okay.
What do you smell?
Orange.
Okay, very good. Okay, next. We're going to check the mouth and throat now. I'm inspecting the trachea.
Okay.
And palpating. Okay, everything is midline. I don't see anything with skin that's out of the ordinary, like a different color distribution. So what we're going to do is you're going to open and your lips are not cyanotic, meaning they're not purple. And I'm going to, have you open your mouth. I'm checking your membranes. They're nice and pink and moist. Your teeth, your soft and hard palates, your tongue, your uvula is midline, and there's about 75% spreading apart of your tonsils to the uvula. I'm going to check for sensation. This is your cranial nerve number 9. What do you taste?
Sugar.
Sugar. Good job. Now I'm going to solicit the gag reflex. That is a cranial nerve number 10. Okay. Sorry. And cranial nerve number 12 will be for you to move your tongue from side to side by yourself. Okay. Both. Yes. Very good. So, okay. Next is going to be the neck. As we said, it's the trachea is equal. We're going to assess your neck by asking you to bend, put your neck forward, back, okay, back to the middle, then go side to the middle, and then side again. So now we're going to auscultate and palpate your carotid and thyroid and your thyroid. So I'm going to auscultate first. I'm going to use my bell. Going to the side here. And I want you to take a deep breath and hold it. Okay. Again. Okay. Now your carotid arteries. Take a deep breath. Let it go. Take a deep breath. Let it go. Okay. There's no bruit that I felt on either side. Now I'm going to palpate. This is for her thyroid. Do you feel pain? Tenderness?
No.
I feel no nodules. Everything's equal. And for the carotid artery, you're going to turn to the side. Turn your head to the side. Okay, next. Very good. So now that we palpated everything, now we're going to check lymph nodes. submandibular. You're going to raise your axillary posteriorly, anteriorly, other side, posteriorly, anteriorly. Okay. So now from the next thing we're going to do is we're going to move it on to the respiratory. So take a deep breath for me. Thoracic is equal and equal on both sides. So the next thing we're going to do is we're going to auscultate sounds anteriorly. Okay, so now we're going to do the same thing in the back. Take a deep breath. Okay. One more time. Okay. So I'm going to ask you to take a deep breath. Again. 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 One more time. And one more time. Okay. Now, next thing we're going to do is to check the heart. So, I'm going to place my stethoscope again and assess your apical, second intercostal space, pulmonic, second intercostal space, Erb's point, third intercostal space, tricuspid, fourth intercostal space, and mitral. Okay. I only hear S1, S2, and no other sounds. Now we're going to check for your JVD. I'm going to tilt your head back. I'm going to put my pen light. 45 degrees, right? My pen light. There's no jugular vein distension. Other side. No jugular vein distension. Now, we're going to check your aortic. I'm going to take a look. Aortic, artery, renal, iliac, and femoral. Now I get to auscultate it. With my bell again. Aortic. I'm sorry. Iliac. And femoral. Sorry. Other side. Okay. So you have a +2, everything is normal. Now, we are checking pulses. We're going to do the radial, brachial, popliteal, tibial, and dorsalis pedis. So, radial. Okay, brachial. Popliteal. Tibial, and dorsalis pedis. While I'm at it, I'm going to inspect her toes, check for capillary refill between toes, sorry, underneath foot, arms, and check capillary refills, and that's it. Thank you so much.